Hi, my name's Tracy Smith. I'm the Director and Podiatrist from the Feet Up Sports Clinic, and today we're going to look at strapping and strapping of the foot in particular, strapping that can be used in footwear, football boots and exercise shoes, specifically to help get rid of foot pain, heel pain and arch pain. Now there's lots of variations on the Lodi that can be used for foot pain, but this is the one that I found the best because what we're looking at doing is we're looking at reducing the distance between where the adductor hallucis longus, which is the main issue that most people have with arch pain, as it attaches from the heel to the first metatarsophalangeal joint, or first MPJ, as I might call it during the course of this video. The other thing that we're trying to do with this strapping, which works well, is to provide support through the midfoot. So what we're going to do first is, just so that we make sure that it sticks on, is use the Friar's Balsam. Okay, makes everything a nice yellow colour, but it's very, very good for reducing allergic reactions and also for making sure that the strapping tape sticks on quite nicely. So the first tape that we're going to put on, directly underneath the lateral malleolus or the ankle bone, or you can start up further from the styloid process. Either way, it's not really, it doesn't really matter where you start there. So you put down your tape on the outside part of the heel, bring it round the back of the foot, and just where this crease is, you bring it through and round to underneath the fifth. Okay, the second tape that you put on is predominantly to shorten the distance between where the adductor hallucis longus attaches onto the medial side of the calcaneus through to the first MPJ. So to shorten that and to get the maximum of effect so that the tape can support that, is we have to actually evert the foot. Okay, so we start the tape from underneath the first MPJ, you evert the foot, come around the inside, through, cross over and back to the first MPJ. Now to provide some support, you can use your 38mm tape. Just hold your foot up for me, thank you. Doesn't matter whether you go from lateral to medial or medial to lateral, makes no difference. Okay, and once again, you start from the outside part of the heel, come around the back of the heel, making sure that it's not too tight, and this will take a little bit of practice. Okay, so then we just pop another one on underneath, just a little bit further up, a little bit more distal from the previous. And then we pop one more from the first MPJ, everting the foot up and around the ankle and crossing over. Very neat styloid process under the first MPJ. Now take note, there are lots of variations of this. This is just the one that I've found over the years that works best. One more hook. And one more just to cover up the end bits so they don't fall off, and then we'll do an anchor. And when we stand up, we should actually see that the big toe should poke out. And as you can see, compared to the other toe, it's actually pulling out on that big toe. Just push it down, which is the purpose that it's actually supposed to do.